We will start this course with a quick introduction to sport and exercise psychology. Sport and exercise psychology is a scientific study of people and their behaviors in sport and exercise activities. This also includes the practical application of that knowledge. Sport and exercise psychologists identify principles and guidelines that help people to participate in and benefit from sport and exercise activities. Sport and exercise psychologists seek to understand and help elite athletes, children, persons who are physically and mentally disabled, seniors, and the average participant achieve maximum participation, peak performance, personal satisfaction, and development through participation. Sport and exercise psychology typically centers around two primary areas: understanding how psychological factors affect an individual's physical or motor performance, or to understand how participation in sport and exercise affects a person's psychological development, health, and well-being. Objective 1. Again, this was to understand how psychological factors affect an individual's physical or motor performance. Some examples of questions studied in sport and exercise psychology related to this objective may include some of the following examples. How does anxiety affect a basketball player's accuracy in free throw shooting? Does lacking self-confidence influence a child's ability to learn to swim? How does a coach's reinforcement or punishment influence a team's cohesion? And does imagery training facilitate the recovery process in an injured athlete or exerciser? Again, to review Objective 2, this was to understand how participation in sport and exercise affects a person's psychological development, health, and well-being. Some examples of questions studied in sport and exercise psychology related to this objective may include some of the following examples. Does running reduce anxiety and depression? Do young athletes learn to be overly aggressive from participating in youth sports? Does participation in daily physical education classes improve a child's self-esteem? And does physical participation in collegiate athletics enhance personality development? Sport and exercise psychologists work in three general areas. Many professionals work in more than one of these areas, but there are three focus areas for sport and exercise psychologists. The three primary roles concerning professional activities include conducting research, teaching, and consulting. Each of these will be discussed in further depth. The goal of conducting sport and exercise research is to advance knowledge and share it through professional meetings and journal articles. Many professionals employed in a university setting are required to participate in research activities as part of their academic appointment. Research is important to study or examine different questions, discover answers, and share that information to help guide the profession. Sharing information can help advance, open discussions, and create healthy debate at professional meetings and within journal article publications. Many sport and exercise psychology experts also teach university courses either within psychology or exercise and sports science. These courses could include exercise and health psychology, applied sports psychology, the social psychology of sport, developmental psychology, personality psychology, motor learning and control, or sports sociology. A third role for exercise and sports psychologists includes consulting with athletes of all ages and abilities within the fitness industry and in sports medicine and/or physical therapy. Consulting could occur with individual athletes or teams and developing psychological skills for enhancing competitive performance and training. The Olympic Committee, some major universities, and many professional sports teams employ either full-time or part-time sports psychology consultants. Some sports and exercise psychologists now work in the fitness industry as well to assist with designing exercise programs and to maximize participation, or to promote psychological and physical well-being. Sports medicine and physical therapy units have also consulted with sports psychologists to aid with injured athletes or individuals. The psychological services can help assist in the rehabilitative process. Within contemporary sports psychology, there are two types of specialties: clinical sports psychology and educational sports psychology. A clinical sports psychologist is a licensed psychologist. They are licensed by the state boards to treat individuals. They have extensive training in psychology so they can treat individuals with emotional disorders. Some athletes and exercisers develop severe emotional disorders and require treatment to continue participation. Things such as eating disorders and substance abuse are two areas in which clinical sports psychologists can offer help and support to sport and exercise participants. The other specialization area is in educational sports psychology. Educational sports psychologists use mental coaching approaches to understand the psychology of human movement. Educational sports psychologists have extensive training in sport and exercise science, physical education, and kinesiology. The goal of these individuals is to educate and increase athlete and coach awareness of issues such as anxiety management and confidence development. When an educational sports psychology consultant encounters an athlete with emotional disorders, they refer that athlete either to a licensed clinical psychologist or preferably to a clinical sports psychologist for treatment. To practice good sport and exercise psychology, we need to master the art and the science of the profession. This is the science of coaching, teaching, or leadership, focusing on using general scientific principles. We must combine that with the art of coaching, teaching, or leadership, and knowing when and how to individualize these general principles.